10 minutes to your health is brought to you by Nestle. Nestle, good food, good life.
All right, folks, Dr. Anissa Holmes is a cosmetic dentist, and this is Jamaica Cosmetic Dental Services. They talk with us about ways to renew your smile. Look at me. Good morning. Welcome to Smile Jamaica.
Thank you very much.
What is cosmetic dentistry?
Sure. Cosmetic dentistry is a focus or an area of dentistry where we focus on beautifying smiles. So people who have been affected by tooth loss, we're able to rebuild and restore. People who are affected by the positioning of the teeth, we can actually correct that using porcelain. People who are unhappy with the color, we're able to do teeth whitening to be able to change the color.
So it's not necessarily that if you have a cavity when a come to you. That's
right. We do fillings in our office, but that's really, I mean, our focus and our passion is on beautifying the smiles and really changing smiles and changing lives.
What I found, and I was telling you, I worked with a dental supply company many, many years ago. What I found that as much as my teeth looks white, it's because I'm a little darker than probably everybody else. Not everybody is white, looks so white, but it's really kind of yellow to be honest.
Well, the thing about teeth and teeth color, sometimes you will find that people who have a certain complexion of skin or gums may have a different contrast, so their teeth may appear darker or lighter, or people who wear red lipstick may have a whiter color of their teeth. But the fact is, when you're really looking on there, you know, they definitely, you know, could be whiter. And
how do I get mine white? I love mine to be white.
Sure. Whitening is very easy. You come into the office and we use a hydrogen peroxide gel that goes onto the teeth. And in doing so, we're able to get the teeth whiter in 1 hour.
It happens immediately?
It does happen in about an hour.
So you could just give it to me and I do it myself?
We also have the whitening where you do it at home, but that's a little bit more involved just because the concentration of peroxide gel is not as strong. And so then what happens is that you have to go for 30 minutes per day for a few weeks. Right.
I understand. We have pictures of someone that you had worked on. Explain to me what it is that you did for this patient.
Right. This particular patient had been wearing temporary crowns or caps for several years that was treated in another office, actually in the U.S. And he came and moved back home to Jamaica. And when we took off the temporary crowns, all of the teeth were basically rotten. And so
that was before.
Right. So once we took off the temporary crowns, that's pretty much what we saw there.
Hold on. So the teeth rot under the crowns. Basically, the crown itself was bad, or did he not take care of it?
No. What happened was that he was in the process of having treatment done and did not complete the treatment. And so it was not like if you have a crown, you're going to have rotten teeth underneath. That's not what happened in his case. He was actually to have treatment done, and for whatever reason did not complete the treatment, which is not indicated, but that's basically where he came in.
That was before.
Right, so that was before.
So hopefully we can see the after. What did you do for him?
So what happened was he came in, and through a series of appointments and procedures, we were able to restore his smile. And he was able to actually have a better smile than he ever had in his life. So we actually built the teeth up. So this is showing us having the teeth built back up. He had some root canals done, actually.
Some root canals?
Yeah. He had to have root canals done, and I mean, this is the after, and I mean, it's quite amazing, you know, what was able to be done by cosmetic dentistry.
This is permanent?
Yes, it is.
What do you mean when you say you build up back the teeth? What did you do?
Right.
Yes, nice smile.
Right. So what happened was we were able to build back up the teeth using materials to actually sculpt back onto the tooth.
Right, and then you can't regrow a tooth.
No,
once
you can't.
It's lost, it's really lost.
No, so we're using porcelain. So it's really, what we do is a fusion of science and also art.
You mentioned through a series of treatments. How many treatments did it take to get from before to after, and how much does it cost?
It actually took approximately 6 months to have the teeth rebuilt because he had to have some root canals done. He actually had to have some treatment on his gums.
We're seeing a graphic. You literally drill into the gum? Is that what you do?
This video that they're showing now is actually a video on dental implants. So this is actually a different. This is actually a different case.
So you're saying how many treatments and how much did it cost?
He had a series of treatments done, and I mean, I'm not sure of the exact figure, but this case is actually very complicated and very complex because of the root canals.
Would be pretty expensive.
Yeah, and he had to have gum surgery as well. But I mean, the amazing thing is that it can be done. You know, a case like this in days past, the patient would have to take out all of the teeth and have a denture. And in this case, we were able to give back his total smile. He can floss between all of them. They're beautiful, they're white, they're strong.
And as I said, they're permanent.
They're permanent. They're permanent.
Speaking of flossing, so I'm looking at his teeth and I'm looking at yours as well. And the gap between teeth is incredibly small. And in fact, they all look even on the bottom, whereas both Neville and I, you can see the curvature of each tooth. How is that accomplished?
In terms of the leveling?
Yes.
Sometimes what we're able to do, and this is really amazing about cosmetic dentistry, sometimes you'll have people who have uneven teeth, but otherwise they're fine. The color is fine, the position is fine, but maybe the edges are a little bit worn, and we're actually able to reshape them. So we're actually able to just sculpt them and recontour them and give a beautiful smile, which takes maybe 5 or 10 minutes, to be honest with you, and it doesn't cost very much because there are no materials really involved. And it's really quite amazing. If you can go, we have a Facebook site and we have all of our pictures on there, and you're able to see cases, and it's quite amazing. And patients say, I can't believe I didn't do this earlier. So,
how does this affect your eating? Does it affect it at all?
No, actually what happens is that once you restore a smile, you're able to eat a lot better. A lot better.
You're able to chew your food properly and all of that good stuff. Is removing wisdom teeth for cosmetic purposes recommended?
I think they're totally separate. So wisdom teeth are removed due to position of the teeth, not be able to clean them, the possibility of having a cyst in the future. So they are definitely recommended, but it's not
for cosmetic
purposes.
It's
not exactly.
Medical purposes.
How prevalent is this? Do a lot of Jamaicans come in for cosmetics?
Absolutely. Jamaicans are really into their looks, really.
So do they come in with really nothing wrong with them, but they just want to? There
are some, but the patients that we're most passionate about in our office, and we're really passionate, are the people who come in and they have, their self-esteem is affected, so we have people who are coming in with defects in the shape or the color, or white spots all over their teeth.
I was just going to ask you about that. Sometimes you see like the color is really bad, but does that mean there's something wrong with the tooth?
Not necessarily, because some people,
coffee, smoking.
Yeah, but some people, I had a little girl, not a little girl, but I had a teenager come in recently and she had white spots on all of her teeth, and it's coming from having too much fluoride when the teeth are developed, right? And she's beautiful, but her self-esteem, she walks around with her face and her hand in front of it, and her father's like, what can you do to help my daughter? Because her self-esteem is so low because of the look of her smile. Those patients are the ones that we're most passionate about.
What do you do with the one that's really badly discolored?
Right.
How do you
if they're discolored and it's just a problem with the color itself, then we can do teeth whitening. But if it's also a defect in the size, sometimes teeth are coming in and they're very, very small. They're undersized coming in.
Or crooked.
They're crooked. Sometimes we'll have to do braces, and sometimes we're able to actually correct those very, very easily with cosmetic dentistry.
And there's lots of different types of braces too. You have the Invisalign, you have the traditional metal, and even those are hard to see these days.
Right. Things have definitely improved.
Where are you?
My office is on Braemar Avenue, which is 1D to 1E Braemar Avenue.
Are you the only folks who do this?
In terms of cosmetic dentistry, I believe that our office is really the main office in Jamaica that focuses really on cosmetic dentistry. We do cleanings, we do beautiful natural tooth-colored fillings, but our passion is on changing smiles and changing lives. And we have a special project coming up, a partnership with Ocean Style magazine. And I just want to announce today that we're actually going to be doing a free smile makeover to someone in Jamaica. So they'll be able to come in. We want to know their story, why they want to have it done, someone who's been affected by tooth color, shape, position, and we want to give them a free smile makeover.
So they apply by coming in and telling you their story?
No, they'll actually go to the website of Ocean Style. It's a partnership between Jamaica Cosmetic Dental Services and Ocean Style Magazine and Ocean Style TV. And they will actually go to their website, which is oceanstylemagazine.com, and there'll be also a link on there for the competition. They'll upload a picture of their smile, zoomed in, and a headshot. All of the details are there. But basically, I will narrow it down based on the photos and their story of why they want to have it done. And I will select 5 finalists will come in for a free cleaning, and then from there I'll select a winner. And then we will announce later and have a story published on the winner and how it's affected their life.
Nice. We'll have you back to show off that winner as well.
I would love that.
Good to meet you. Thanks for coming in.
Thank you.
Dr. Anissa Holmes, cosmetic dentist, Jamaica Cosmetic Dental Services. 10 minutes to your health. We'll do it again next